Hi, this is Christine Coe for Carestream Health. I'm here with Mary Terry, the Chief Content Officer for clinicalinnovationsTechnology.com.
That's right.
How are you?
I'm great.
HIMSS
How are
2016.
you? And here we are. Happy
Here
HIMSS.
we are in Vegas.
Yep.
Lots of exciting stuff going on.
Yep.
What are you seeing, and what are some of the predictions, if you will, for HIMSS 16?
Well, I think what some of the stuff we're going to talk about with cloud, obviously, is a huge thing. Enterprise imaging in general, obviously, is a big buzzword within our microcosm of HIMSS. I mean, not speaking on the payer side and things like that, but when we're dealing with healthcare data, it's all about analytics. It's all about utilizing all of the information that we have.
Absolutely.
Linking caregivers together, linking facilities, linking patients. So we need the patient engagement that we really haven't gotten up to this level.
Right, absolutely.
So I think there's a lot of cool stuff on the floor. I know this is a pretty cool project that you guys are working on. So maybe you can tell me a little bit about it.
Yeah, I do think you're right. The patient engagement part is where a lot of companies are going. I do think not because the company is pushing it, more because the patients themselves are demanding it, right? If you look
but
at
there's a lot of savings. I mean, there's a ton of money to be saved when you're engaging your patients and they're not coming back to see you for various episodes.
Different reasons, absolutely.
Episodes
and you think about, I think there have been previous studies done where imaging, for example, 10% of imaging exams in the U.S. is done in duplication, right?
Right.
So because priors weren't accessible, because patients may not know about it, because they're part of that conversation,
right.
All of a sudden now you're right, cost savings 10% right off the bat.
Right.
So one of the things exciting that we do see, is we started seeing sort of non-traditional players into the healthcare IT space. In China, for example, we just started a partnership with Alibaba Health,
right.
Where they're seeing a sort of an internet cloud-based platform to provide medical imaging services. We're very, very privileged to be the imaging solution provider in that platform, where they see, taking that online to offline model to engage patients, not just online in the e-commerce sense, if you will, but also taking them to the right providers after the consult or after accessing their information. So think of possibilities for telemedicine, right? Underserved patient areas and rural areas, to just having patients having a better engaged dialogue with their physicians because they have access to their health record. So we're seeing that trend starting to come in even in other countries as well.
Right.
Where patients
so how does
part
this?
of that
But just give me a quick overview though, as far as what does this mean within China, and then I'd love to hear what do you see the global ramifications.
Yeah, so in China specifically, I mean, it's early on in the partnership, obviously. Yeah. So we're talking about, again, how do we help complement all the other stuff that they're doing within Alibaba Health. Is they kind of envision this sort of online medical services platform in the cloud, right? Something that's very secure, very convenient for the patient, to now maybe looking at, imaging is part of that service, if you will. So I think that's very transparent in lots of other parts of the world. We're actually having conversations this week with several different ministries of health, a couple of different projects in large regional health systems where they're trying to figure out a better way of either consolidating data or just being able to distribute information at the point of care.
Right.
And so that's not just, again, not U.S. specific. I think it's a global trend, where cost is always going to be an issue.
Right.
But now on top of that, you have cybersecurity. Given the recent events in California, to when you start to talk about technology like cloud, how do you make sure it's secure, it's HIPAA compliant, have audit trail, all that, etc., starting to come into play, which makes, I think, health IT just so much more exciting, right? We're just a little bit more complex than just the traditional e-commerce, but
this is an extraordinarily complex
highly regulated,
right.
exactly, and then IT is at the core of that, so very exciting.
And it is at the core of that patient care.
It is, absolutely. So with that, thank you so much for stopping by. We appreciate always your input, and for that, we're going to say goodbye now, at the HIMSS booth.
That's great. Thank
Thanks.
you.